In this segment, we're using counterstrain to treat the related tender points, which are called the anterior C7, and then we'll show you how that's different from the anterior C8. This anterior C7, we have you just to lift your head up just a little bit. You can see the sternocleidomastoid and then the little lateral here. So the anterior C7 is more in this little groove right here, more laterally. So we're going to find the tender point there, identify that as a 10 for our patient, and then we're going to flex up just a little bit, but the patient doesn't help, so just fall back. That's good. And we're going to side bend a little bit to that side, rotate a little bit away from that side, get that totally relaxed, and then recheck and get that down to a 0. Hold that for about 30 seconds, and then recheck just so we might have to retune it, fine-tune it there to take some of the tension off. Hold that for another remaining 60 seconds for a total of 90 seconds, and then slowly reposition the patient back to their neutral and recheck the tender point. The position for an anterior C8 tender point is going to be much more medial to the medial clavicular area. Now let it drop, and now what we're going to do is find the tender point here, and the position here is to flex it up with the patient relaxed, and then side bend away, rotate away, like the anterior C2 to 6 tender points were treated. And then recheck it, 30 seconds, recheck it again for fine tuning, and then after the remaining 60 seconds for the total of the 90 seconds, slowly bring the patient back to midline, turn her back slowly to the straight position, let her head just fall back, and then recheck the tender point. Anterior C8 versus anterior C7 out here.